Well, since December, the CDC has warned travelers to avoid cruises regardless of their vaccination status. Officials say since the surge of the Omicron variant, there has been an increase in the number of COVID-19 cases among cruise passengers and its crews. That issue impacting Bakersfield residents who are wanting to get back onto the water. 23 ABC's Taylor Levesque joins us from the Live Center with more on how pandemic protocols aren't keeping COVID-19 from getting on board. Taylor.
In addition to requiring masks, social distancing, and pre-embarkment testing, so far cruise lines like Norwegian, Carnival, Royal Caribbean, and Celebrity Cruises and Disney Cruise Lines are requiring all crew and guests who are eligible to be fully vaccinated against COVID-19. However, even with strong mitigation efforts to keep COVID-19 off board, one Bakersfield resident is warning travelers to take a break from traveling the seas after she says her family fell ill during their latest vacation on a Norwegian cruise.
This was our 12th cruise with Norwegian, so we were really excited to vacation again after a long period of not vacationing.
It all started as an annual cruise family vacation for Heather Silvis and her family. On December 22nd, they embarked on the Norwegian Escape, an 11-day cruise stopping at 8 ports along the way.
Some of the ports were really mask heavy. They required masks even just being outside.
Until it took a turn for the worst. After her son tested positive for COVID-19 while on board, Heather says she begged the crew to also test her family after they refused.
The Norwegian Escape, I believe wholeheartedly that they weren't testing people that they knew were exposed, that they knew were symptomatic, because if their numbers got over 1%, they had to let the CDC know.
President of Uniglobe Global Empire Travel, Ray Watson, says safety measures on cruises were effective until COVID-19 cases surged worldwide.
All of us, whether it's going to a school or a restaurant or a cruise, things have changed dramatically. So the advent of this new variant has caused a whole lot of disruption.
According to Norwegian's COVID-19 policies, if you feel symptoms while on board, you should contact the ship's medical center for further instruction. And if a positive test is identified, contact tracing and treatment will begin immediately. But Silva says that didn't happen.
First off, there was no contact tracing. When my son tested positive for COVID, they didn't even contact the other people who were in my family that were in different cabins, let alone contact all the people that we had been on excursions with, hanging out with.
Silva says by the time the cruise disembarked, they were all sick, and the cruise line transported all sick passengers to a hotel for quarantine.
The hotel manager just said, listen, your name should be on this list. You're going to have to pay. It was somewhere between $3,000 and $5,000 to stay in the hotel. There won't be any food provided for you. There won't be any medical provided for you, but you're going to have to stay in this hotel upwards of 10 to 15 days.
But Silva says she couldn't afford to pay out of pocket, and when the hotel manager said they weren't required to stay, they flew home back to Bakersfield.
I'm not mad that we got COVID. We knew the risks of traveling. We knew the risks of being on a boat with a lot of people.
We reached out to Norwegian. They declined to comment on the situation. Now, taking a look at the CDC's cruise ship color status, it shows how the CDC is conducting investigations based on the number of COVID-19 cases on board of any cruise ship sailing waters. For example, if it's orange, COVID-19 cases were reported in less than 10% of passengers, and no crew cases were reported in the last 7 days. To review this map, head to our website, turn23.com. At the Live Center, Taylor Levesque, 23 ABC. Connecting you.